Tonight. And joining me now is Dr. Ben Carson, Secretary of Housing and Urban Development. Dr. Carson, I want to go back to this during the Senate hearing today, where lawmakers did press Dr. Fauci on the consequences of keeping schools closed. Watch.
I think the one-size-fits-all that we're going to have a national strategy and nobody's going to go to school is kind of ridiculous. It's a huge mistake if we don't open the schools in the fall.
Has there been any sort of kind of risk-benefit ratio for the child? Particular risk for missing out on a year of education, particularly for those from less enriched backgrounds?
The unintended deleterious consequences of having children out of school. We fully appreciate that. I don't have an easy answer to that. I just don't.
Is that a little troubling that this is where we are? As a member of the task force, what do you think needs to happen now? Parents across the country are freaking out that their kids are not going to go back to school next fall.
You know, one of the reasons that we have a president is so that they can weigh all these different opinions that come from all kinds of different directions. And the president's doing a good job of that. I expect people in the scientific arena to always be dotting all the I's and crossing all the T's, and always being extra cautious, particularly if they're physicians. But that's the reason probably that they're not the ones who make all the decisions. You have to have somebody who can integrate all these things. And obviously, one size does not fit all. That is so important. And, you know, this is the land of the free. Maybe sometimes people forget that. But, you know, there's a reason that America rose from nowhere to the pinnacle of the world in record time. It's because we had people who were free to use their gifts, their innovation, their entrepreneurship. And we had people who were brave, people who were willing to take risks. Unfortunately, there is no risk-free atmosphere, and we have to weigh these things. You know, when you look at the hotlines for mental illness and substance abuse, they skyrocketed in April. And you look at all the negative consequences that come from sequestering people. We have to begin to think about those things as well and weigh these things. Doesn't mean that we don't have to be careful. We've learned a lot of things. We've learned about hand washing. We've learned about social distancing. We've learned to be careful about the things that we touch. Social distancing, all these things are important. And if we use them intelligently, we can integrate people back into the workforce. This country was built on work. Mm-hmm. It wasn't built on sitting around and waiting for the government to do everything for you.
Are you concerned that what you're seeing in states especially that have, much of their state has very little COVID, I mean proportionally, very small, especially compared to the horrific flu season we had, which was one of the worst in the last, I think, 40 years, the last flu season, although the CDC can't get its numbers straight on that. But are you worried that this response by some state and local officials is appearing to be more politically based than medically based?
Well, either that or it's a great coincidence. I'm not sure. I would love it if all the governors and all the local officials would simply say, let's sit down and look at the evidence. Remember, for instance, in Georgia, there was all this criticism a few weeks ago because Governor Kemp said, I'm going to open things up. Well, he did open things up. Have we had a tremendous spike there? If we have, I haven't heard about it.
No, we haven't.
You know, we need to be we need to be willing to really sit down and objectively look at the data and look at the data on both sides. What is the damage from contracting the virus? What is the damage from destroying the economy? And look at the long-term implications of that. And I think you'll come out on the right side if you're willing to do that.
The Washington Post headline, I just tweeted it a few moments ago, Dr. Carson, 100,000 businesses are set to close. More than 100,000 small businesses have closed forever as the nation's pandemic toll escalates. That's a lot of human lives, don't you think?
Absolutely. And every day that we keep things shuttered, more businesses will close. Now, there is a good thing. And the good thing is a lot of the A lot of the brush is burned off, and new businesses will spring up because the infrastructure is still there.
Yeah,
Absolutely.
Dr. Carson, sorry to cut you off. Thanks for joining